Hello everyone. You are watching now, your medicine videos channel. Today, we are going to briefly talk about paracetamol. Paracetamol is an analgesic, means pain reliever, and antipyretic, means fever reducer. It works by blocking the release of certain chemical messengers that cause pain and fever. It is also used to treat many conditions, such as headache, body ache, toothache, and common cold. It is also effective in relieving pain caused by migraine, nerve pain, sore throat, menstrual or period pains, arthritis, and muscle aches. This medicine is very widely used and very rarely causes side effects, if taken at the right dosage. Take it as it is prescribed to get the most benefit. Do not take more or for longer than needed, as that can be dangerous. In general, you should take the lowest dose that works for the shortest possible time. It is also the first choice of painkiller during pregnancy or breastfeeding. Now, let's discuss the side effects of paracetamol. Most side effects do not require any medical attention and disappear as your body adjusts to the medicine. Consult your doctor if they persist or if you're worried about them. The common side effects of paracetamol are stomach pain, nausea, and vomiting. How to use this medicine? Take this medicine in the dose and duration as advised by your doctor. Swallow it as a whole, do not chew, crush, or break it. Paracetamol is to be taken with food. There is some safety advice. Number 1, alcohol. Don't take this medicine with alcohol. Number 2, pregnancy. Paracetamol may be unsafe to use during pregnancy. Although there are limited studies in humans, animal studies have shown harmful effects on the developing baby. Your doctor will weigh the benefits and any potential risks before prescribing it to you. Please consult your doctor. Number 3, breastfeeding. Paracetamol is safe to use during breastfeeding. Human studies suggest that the drug does not pass into the breast milk in a significant amount and is not harmful to the baby. Number 4, driving. Paracetamol does not usually affect your ability to drive. Number 5, kidney. Paracetamol should be used with caution in patients with kidney disease. Dose adjustment of paracetamol may be needed. Please consult your doctor. Number 6, liver. Paracetamol should be used with caution in patients with liver disease. Dose adjustment of paracetamol may be needed. Please consult your doctor before taking this medicine. However, the use of paracetamol is not recommended in patients with severe liver disease and active liver disease. So that's it. These are the brief discussion on paracetamol. I hope you enjoy the video. Don't forget to like, share, subscribe, and click the bell icon for more updates. Thanks for watching.